And I think with that said, the first major component that I want to talk about today is health insurance market reform. So recognizing the need to end many of the unjust insurance industry abuses, Senator Bingaman worked hard to include many key insurance market reforms in the law. So what are these insurance market reforms? Well, the first is prohibiting insurance companies from denying people coverage based on pre-existing conditions, and that's going to begin for all plans starting in 2014. However, the law also provides for immediate access to affordable coverage for those with pre-existing conditions. So how do I say that it's going to start for all plans in 2014 and tell you that you have immediate access if you have pre-existing conditions now? Well, there's two things. Children with pre-existing conditions are covered immediately. Did you all see that? Have you been aware of those provisions? It's an excellent provision. It's huge for the state of New Mexico. What would be a pre-existing condition in a child?
Diabetes.
Asthma, diabetes, heart, children-related cancers you often see. Those are the kind of things that many insurance companies would say, sorry, we're no longer covering you, you have a pre-existing condition. Uninsured adults due to pre-existing conditions, so for example, you have a thing that's determined as a pre-existing condition and you can't get insurance, those people can get immediate insurance through a temporary high-risk pool starting in July. Are you all aware of this? The federal government, starting this July, actually sent the state of New Mexico $33 million to start a high-risk pool for adults with pre-existing conditions. New Mexico already has a high-risk pool going for people with pre-existing conditions. So why is that beneficial to New Mexico that the feds also did this? Well, because obviously we're going to be able to supplement the state pool by having the federal pool. So it'll take some of the pressure off of state tax dollars and be able to, because the state is subsidizing that high-risk pool, and be able to also put new people into the federal pool. And the other thing that's really nice is that we're running it out of the same office, so there's no duplicative administration and overhead in that regard. And I think we're ahead in a lot of states, compared to a lot of states who have never done a high-risk pool, don't know how to run it, and aren't exactly sure of how this thing actually works. And so our state is actually doing some great work. Just talked to a woman with cancer the other day who's 51 years old living in Tesuque, and she no longer was unable to afford coverage, and her employer actually laid her off because she was so sick. So then she had she was in a situation where she couldn't get coverage, she couldn't afford coverage, and she had a pre-existing condition, and actually the state high-risk pool was able to provide her coverage. So it is working for everyday New Mexicans, and I think these are the kind of stories that need to get out there in the more mainstream public. With that said, also the policy must be available to all people, they can't discriminate, and they must be renewable. Let's talk a little bit about discrimination. In some states, women pay as much as 30% more for their premiums and insurance. Why is that? Pregnancy. Other reasons why insurance companies would justify raising the rates? More female diseases. Certainly maybe gender-specific cancers like breast cancer, things like that, ovarian cancer. But what's interesting is that women who had no desire to be pregnant, have never become pregnant, also have no history of gender-specific cancers, also were charged more. So the law is going to put an end to gender discrimination and other forms of discrimination. Also, the law says that all policies must be renewable. Why is that important? Why is that relevant to many New Mexicans, and have many New Mexicans have faced this situation? If you get sick, the insurance companies may say, okay, we'll cover you through this year, but when you go to re-up your policy, sorry, this policy is no longer renewable. Many New Mexicans face that situation. This says all policies must be renewable. You can't just drop somebody when they're sick. The other things that this law is going to do is it's going to stop rescission. And essentially rescission is the fancy insurance term that's basically stopping insurance companies from rescinding or canceling policies when someone gets sick or there's a pre-existing condition determined. I'll tell you all a story about that in a second. Also, starting this last September, the law extends dependent coverage for young adults who are on their parents' plan until the age of 26. This is really critical here in New Mexico, because many people found that when they graduated college, they were on their parents' plan. Once they graduated, they got knocked off their parents' plan. If they could get a job, which is not necessarily true in this economy, their job may not provide them insurance, and they were kind of left on their own. This provision is going to allow them to stay on their parents' plan until the age of 26, which is particularly helpful in this economy. One story I want to talk about real briefly and kind of show how this all fits together in a New Mexican context was a young woman came into my office in March. She had just graduated from Highlands University, and she said with the graduation party that her parents threw, she also received a letter from her insurance company here in New Mexico saying, sorry, you can no longer be covered under your parents' plan.
I believe the state legislature changed that several years ago, so in New Mexico it has been the age of 25 years.
But no, in the federal law will supersede that to be 26.
Right, so we extended it later.
Right, exactly. That's right. So New Mexico already had 25, but it was also very narrow in some cases. In some cases, the New Mexico law wouldn't apply, and that was part of the issue. So the feds actually superseded that, but that's exactly right. So let's put this in this Highlands context. This young woman comes to our office, says, what is healthcare going to do for me? I got dropped off my parents' plan. I went and got, she was faced with a choice. Either I go uninsured, like many New Mexicans are faced with, or I try to get coverage on the private market. This young woman, 22, 23 years old, made a very responsible choice in the sense that she went out and bought private coverage. She went to her doctor, filled out all the paperwork, had her initial screening and evaluation, and the insurance company said in order to pay for that initial screening and evaluation, we want to see the paperwork. So she signed the releases, and they sent it to the insurance company. The screening and paperwork revealed that when she was 18 going on 19, the young woman had had an eating disorder. She had had struggles with anorexia. She had worked through them as a senior in high school and a freshman in college, gone through a lot of counseling, and really felt that that was something that she had kind of put behind her in terms of her medical condition. She obviously will still struggle with that often as a lifelong disease, but at the same time, she still felt that the main bulk of that issue was no longer part of her life. So the insurance company said, sorry, you have a pre-existing condition with that eating disorder. We're going to rescind the policy, cancel the policy. Here's your money back. You're on your own. She went out to the rest of the private market and she said, can I get insurance? They said, sorry, you've been red flagged as having a pre-existing condition. You're on your own. So this woman who's 22, 23 years old is coming to our office freaking out saying, if something really catastrophic happens to me, I could be in debt for the rest of my life trying to pay that off. What do I do? I said, this law is enormous for you for numerous reasons. First of all, under this law, you can stay on your parents' plan until the age of 26. Second of all, you can actually get coverage if you're deemed to have a pre-existing condition under the high-risk pool. And third of all, the insurance companies are no longer going to be allowed to rescind your policy as a result of this law. So it kind of has a threefold net effect. As you can see, that's really important to see how all these pieces are interrelated. And small businesses face these kind of realities. You may have an employee who has their policy rescinded, or you may have an employee who's deemed to have a pre-existing condition and gets dumped from coverage. Or as a small business, you may offer insurance and find out that your policies are no longer going to be renewable. So these things have major implications, obviously, for small business. So what does this law mean if you have current coverage? How many of you have coverage right now, health insurance? Good, excellent. What does this mean? Well, the first thing it's going to mean is it's going to set a basic package of benefits to ensure that your coverage is meaningful. Why is that important to you all? Well, one of the things that insurance companies has done is every year when it re-ups your policy, it starts to chip away at that minimum floor package of benefits. So you go to the doctor this year, you expect services that were paid for last year to be covered, and all of a sudden you receive a note saying we're no longer covering these services. What many insurance companies have been doing is saying we're providing you the same insurance, but we're going to charge you more. But in reality, what they're doing is they're actually chipping away at the minimum floor package of benefits. So they're offering you less, but actually charging you more. And you often don't know it until you get to the doctor's office, have the service, and then you thought it was paid for, and you get a bill for it. So that's one of the things it's going to say. You can't go below this threshold of minimum, inpatient, outpatient, preventative kind of benefits. The other thing is that this law is also going to require that all policies must cover preventative services. You're no longer going to be required to pay a copay or a deductible for your preventative services. That's going to be built right into your plan. This is huge for New Mexico because we rank currently last nationally with access to care and the use of preventative care. This is major. In a state where you have major issues like children's diabetes, preventative services are absolutely crucial. It's also a very crucial cost containment provision because if you think about what is more effective economically, to react to a disease or to prevent a disease from happening. I mean, that just makes, I think, very common sense to most people, and you can see how cost containment is a major idea within prevention. The other thing that this law is going to do is going to cap out-of-pocket costs. On your table, there's numerous handouts. Everything you need to know in the presentation today is in those handouts. But one of the handouts that's on your table is a joint study between Harvard and Cambridge that actually found that half of all bankruptcies in the United States are medically related. And of these bankruptcies, 3/4 of the people had health insurance. That's astonishing. Why do people buy health insurance? Because they want to be safe and protected from bankruptcy and from having to, forfeit their kids' college funds and having to take out a second mortgage and lose their house just because they get sick. So people who thought they were secure actually ended up finding out that they were having to declare bankruptcy because they weren't secure. Because oftentimes their policies wouldn't be renewed, they'd get dumped from coverage, there would be an imposition of an annual or lifetime limit. You all familiar with that? Many policies basically have annual or lifetime. Many policies prior to the law, and the law bans this, had annual and lifetime limits, which means You know, you may have an annual limit of $250,000 in your policy. Most people don't even know they have these limits. You get sick over that year, maybe say, you know, you get diagnosed with cancer, you start going chemo, it's very expensive. $250,000, you hit your annual limit, the insurance company writes you a letter, says, sorry, you've hit your annual limit, we're not paying for anything else. Everything else is out of your pocket, which can be devastating and can be one of the main contributing factors for bankruptcy. This law is going to actually cap your out-of-pocket cost. So for an individual right now this year, and it's going to be adjusted every year, but for the individual this year, it would actually be $5,950 would be the max amount that you'd have to pay out of pocket, which is fairly reasonable considering most people could be paying up in the, you know, 10 to hundreds of thousands of